Hello everyone, I'm Dr. Jiji George, Professor and Head, Department of Oral Pathology, Banarsi Das College of Dental Sciences, Lucknow. So I'm today going to speak about maxillary permanent central incisor. So as we all know, maxillary permanent central incisors are centered in the maxilla. So this is how we represent the dentition. So you can see out here that the dentition, the permanent and the deciduous dentitions are represented in a horseshoe shaped manner. So we start from, if I start from the left hand side of this is the maxillary teeth, and these are the mandibular teeth. So this is the third molar, second molar, first molar, second premolar, first premolar, canine, lateral and central. So the colored ones are both central incisors. Now onto your left side, you can see the central incisors which are permanent maxillary central incisors, and to your right side, you can see the deciduous maxillary central incisors. So that's how we usually depict the uh, teeth. So they are basically centered in the maxilla. Now there are some features which are very characteristic of a central incisor, and it is not seen in any other teeth. The first and foremost is that their mesial surfaces come in contact with each other, their opposite side. What I mean to say is central is the only tooth in which the mesial surface of one central contacts with the mesial surface of the other central. In any other tooth, the mesial surface of the lateral comes in contact with the distal surface of the central. So it is only in the midline, it's just the central incisors where the mesial surfaces of the opposite sides come in contact with each other. Now, mesiodistally, they are more broader than the ones which are lateral to it. So, it is the widest among the anterior teeth which are mesiodistally widest. Now, there's an incisal ridge which is very sharp in newly erupted teeth. Now, you must have seen babies with newly erupted teeth, and when they are just erupted into the oral cavity, it is more or less comparatively sharp with mamelons. So what is mamelons? I'll explain it later. So the incisal portion is pretty sharp. It is called as an incisal ridge. But then gradually, when the baby starts eating food, there's a lot of friction, due to which these incisal ridges become more flatter, and then we call it as an incisal edge. So this flattening of the incisal ridge is called as attrition. So attrition happens, it's a very physiological process of regressive alteration which is seen on the tooth surface. It will be seen on the cusp tips in posterior teeth and in the incisal tips in the anteriors. So when the incisal ridge is a sharp edge of the newly erupted tooth, which is pretty sharp, and it is seen as a line. If you take an impression of that, it will be seen as a line. Whereas incisal edge is the same incisal ridge which gets flattened out or attritioned to form an incisal area. So that is a area, not a line. So that's the difference between incisal ridge and edge. It's practically the same. It's just that in a newly erupted tooth, it's seen sharp as a single line, and it's seen as a surface in a tooth which has undergone attrition. Now, functions of the maxillary central incisor. First of all, mastication. Any tooth is helpful in mastication. Secondly, phonetics. Phonetics means it helps in the articulation of speech. Now, we all have different ways of speaking. So most of it, most of the times, people are not able to speak properly because they have maloccluded tooth. So it's very important to have incisors which are properly articulated. Now, it also helps in aesthetics because it's the first tooth that you would see in a patient's face. That is, when a patient smiles, you first actually involuntarily look at their teeth. So the teeth give a lot of lip support and improves the appearance of the person. So maxillary central incisor is the first tooth which mostly all of us observe when a person smiles looking at you. Now, the last function is it guides the closure of the mandible. That is, the mandible. When you close your mouth, the mandible is the only bone which actually moves on your skull. So when you close the mouth, the mandible just comes and closes on to the occlusal surface of the maxillary teeth. So it is the maxillary central incisor which basically guides the mandible against overclosure. So that's why guidance in the closure of mandible is very important. Now, these are the dimensions of and chronology of the maxillary central incisor. It's extremely important to understand each of these dimensions and the milestones in the development of tooth, because clinically it may help you in diagnosis of certain problems in the clinical condition, and the dimensions would help you carve out a good prosthesis or a crown in the lab for that matter. So, and in root canal treatments, the length of the roots and everything, the anatomy of the tooth is very important, which is why we make use of all these dimensions. So you can see that the mesodistal diameter of the crown is 8.5 at the cervix. At the cervix, it is 7, and otherwise the mesodistal diameter of the crown is 8.5, which is the maximum in amongst all the other anterior permanent teeth. Now, first, let's come to the labial aspect. Now, what is a labial aspect? When whatever you see from the side of the lips is called as the labial aspect. So, what you see from front facing the patient is called as a labial aspect. So, from the labial aspect, you can actually see the crown and the root. Now, one point which I want you all to understand is that whenever you get a tooth, you have to explain the tooth, keeping the tooth in the anatomical position. So, if it's a maxillary tooth, you would maintain the crown of the tooth below, and you would place the root of the tooth above. So as in the picture, you can see that there's a crown and the root. So the shape of the crown is more or less like a rectangle. It's not a square totally, but it's like a rectangle. And if I talk about the borders of the crown, as I'm moving the cursor, you can see that the cervical line, this upper border is called as a cervical line. So cervical line is semicircular, and this it separates the root from the crown. So on a histological basis, if I say what is the cervical line, it is the line that separates the enamel from the cementum, because cementum covers the root surface and enamel covers the crown surface. So this is basically the cemento-enamel junction, the cervical line. So this is semicircular in nature in case of a central incisor, and the convexity is towards the root apex. The convexity of the cervical line is towards the root apex. And the lower border of the crown is called as the incisal ridge, which I already mentioned that it's sharp in a newly erupted tooth. Later on, with attrition, this line becomes the incisal edge. Now we have two more sides left. So the side on the right hand of the picture, which I'm moving right now, the cursor I'm moving here, this is the mesial outline. And on the left side, you have the distal outline in this particular picture. Now let's try and explain both the outlines. So the mesial outline, you can see that it's more or less straight when compared to the distal outline, which is more or less rounded. Now, we also have to understand what is the contact area. Now, contact area is where one tooth comes in contact with the adjacent tooth. So, obviously, this is the mesial outline. Mesial to the central incisor, you will always have the other central incisor of the opposite side. So, on the mesial outline, you will have a contact point where it comes in contact with the opposite side central incisor. And on the distal contact area, you will have the lateral incisor coming in contact with its mesial surface. So the mesial surface of the lateral incisor comes in contact with the distal outline of the central incisor. So that's how the contact areas are made. So where the contact areas is comes here, I'll explain it in the next couple of slides. Now coming on to each outline, like I explained the cervical outline and the incisal outline. I said cervical outline has got a semicircular nature with the convexity of the semicircle towards the apex, root apex. So that is a semicircular line with the convexity towards the root apex. And the incisal edge or the incisal ridge is basically a straight line seen in the incisal third. Now, for ease of explanation, I can basically divide this crown into three parts. So when I draw a line here horizontally, this third is called as a cervical third because it is closer to the cervical line. And this lower third is called as the incisal third, which because it is closer to the incisal line. And in between the cervical and the incisal third, you have the middle third. So we can divide the crown into three parts. That is the upper cervical third, middle third, and the lower incisal third. So now I will go on to explain the mesial outline. So when you explain the mesial outline, I would say that the mesial outline starts from the cemento-enamel junction or the cervical line, and it starts as a straight line, and it has a sharp mesio-incisal angle. Now this angle is the mesio-incisal angle. An angle is always formed by the merging of the mesial outline and the incisal outline. So the mesio-incisal angle basically is very sharp. So this is the mesio-incisal angle, which is very sharp. So the contact area will actually be seen at the point which is showing maximum width. So the maximum width is seen at the mesio-incisal angle, and this happens to be the contact point on the mesial outline of a maxillary central incisor. So on a maxillary central incisor, there's a distal outline which is more rounded. So there's always a comparison. When I say more rounded or more sharp, I would always compare it to something. So when I say that the distal outline is more rounded, I would rather compare it to the mesial outline. So compared to the mesial outline, the distal outline is more rounded, and the disto-incisal angle is rounded when compared to the mesio-incisal angle, which is sharp. So the crest of curvature is at the junction of the incisal third and the middle third. So that's where I put my cursor right now. So the contact point on the anteriors have got point contacts, and posteriors have got area contacts. So the contact point on the distal outline of the central incisor will be at the junction of the incisal third and the middle third. So that's about the height of curvature or the crest of curvature and the contact point. So the crest of curvature here will actually correspond to the contact points. So coming on to the root is again triangular in shape. If you can draw a diagram of the root, it's a triangular in shape. And the base of the triangle is along the cervical line, and the apex of the triangle is at the tip of the root. So the root also has got a mesial outline and a distal outline. Now it has a blunt apex. Now there are something called as some structures called as mamelons, which are seen in newly erupted tooth on the incisal edge. I'll show you pictures and make you understand it better. So I've already explained this portion. Now this is just for your understanding, as in how a normal tooth, natural tooth looks like. So this is a natural tooth, and that's the proportionate shape of the natural tooth. And this picture is just an enlargement of the same natural tooth. So what can you see here? You can appreciate that there is the enamel on the crown and cementum on the root. And you can see that the cemento-enamel junction is basically a cervical line which is semicircular in nature, and it separates the cementum from the enamel which is seen on the crown. So coming on to the next slide, you can see these are natural teeth. You can see that the mesio-incisal angle of both the central incisors are basically sharp, and the disto-incisal angles are rounded. Now these are called as mamelons. If you can see these small protuberances here, now these are called as mamelons. Now these mamelons are seen only in newly erupted tooth at the incisal edge, and otherwise these mamelons will get worn away due to friction after the person starts using the tooth more often. Now coming on to the palatal aspect or the lingual aspect, that is just the opposite of the labial aspect. So similarly, it has the crown and the root and the cervical line, and everything is the same. It is just that when you take a tooth and you hold it from the palatal aspect, now initially you held it in the labial aspect. Now when you hold it just on the opposite side, that's your palatal aspect, which you see from, if you had eyes from inside the oral cavity from your tongue, you would see the palatal aspect. So on the palatal aspect, we have these developmental grooves, which are inverted W-shaped grooves. Okay, so this I'll explain it to you once more. So in the picture, you can see an inverted W-shaped groove which is made over here. So that is this line that you can see. So above this inverted groove, you have this area which I'm showing the cursor out here. This is called as a cingulum. So the cingulum area is more prominent, and below the W-shaped groove, the inverted M-shaped, inverted W-shaped groove, we have the lingual fossa. Now I'll come to each of that separately. Now that's how the lingual surface looks like. So from the shiny area on this tooth, you can actually understand that there is a cingulum or a elevation out there. So that's a cingulum. And just below the cingulum, there is a fossa or a depression. This is called as a lingual fossa because it is seen on the lingual aspect. And then you have a inverted W-shaped groove over here. This is the inverted W-shaped groove. And on either sides of the groove, you can see again an elevated area. So this elevated area is called as a marginal ridges. So one is the mesial marginal ridge and the other is the distal marginal ridge. So how will you understand which is mesial and which is distal? The sharper side is mesial. So this is the more sharper side, that is mesial. So that's the mesial marginal ridge. This is the mesio-incisal angle, which is more sharper. That's a distal marginal ridge. And this is the more rounded disto-incisal angle. So this is the incisal edge, and this is the lingual fossa, which is the depression, and that is the cingulum, which is the elevation just seen above the lingual fossa. And here, similar to the label aspect, you can see that cervical line is convex with the semicircular with convexity towards the apex of the root. So once again, to show you a pictorial representation of a maxillary central incisor, you can actually see that this is the cingulum. Again, if I divide the tooth into three parts, the cervical third has the cingulum, which is a prominence. And then when you come to the middle third, you have the lingual fossa, which is a depression. So between the lingual fossa and the cingulum, you have this inverted W-shaped groove. So the inverted W-shaped groove separates the cingulum from the lingual fossa. And on the right side, you have the ridge called as the mesial marginal ridge here. In this case, it's on the right side. And that's your mesial marginal ridge, which is an elevation out here. And on the distal side, you have the distal marginal ridge, which is a linear elevation. So this is the boundary of the lingual fossa. And incisally, you have the incisal ridge. So if I ask you what are the boundaries of the lingual fossa, you would say that the lingual fossa is bounded cervically by the cingulum, mesially by the mesial marginal ridge, distally by the distal marginal ridge, and incisally by the incisal ridge. So that's about the palatal aspect. And coming on to the mesial aspect. Now, mesial aspect is when you basically turn the tooth in a mesial direction, and whatever was towards the midline is now what you are looking at. So this is the mesial aspect. So the mesial aspect has got a labial outline, a lingual outline. I'm talking about the crown. You can see where I'm moving my cursor. You can see a labial outline. You can see a lingual outline, and you can see a cervical line. So the cervical line similarly divides separates the crown from the root. But you can see that very characteristically, the cervical line is very different from how it was on the labial and the lingual aspect. Because the cervical line is, again, it's not exactly a semicircle, but it takes a dip towards the crown. The convexity is towards the crown, not the root. The concavity is towards the root. Whereas it was just the opposite in your buccal outline and your buccal aspect and your lingual aspect. So that is a major difference in the cervical line from the proximal aspects and the buccal and the lingual aspects. So if you draw a straight line here, you can actually measure the dip of the cervical line. So the dip of the cervical line in the mesial aspect is actually more, and that is less on the distal aspect. So that's how you can compare and contrast the mesial aspect from the distal aspect. Now, if I speak about the labial outline, before that, I have to divide the crown into three parts. Like similarly, what I did in the labial aspect, I would rather divide the mesial aspect also into three parts. So the first part, which is close to the cervical line, is called as the cervical third. Then we have the middle third, and then we have the incisal third. So now if I have to explain the labial outline, I would say that it starts from the cervical line on the cervical third, and it shows a maximum crest of curvature at the cervical third, junction of the cervical and the middle third. Now, when I say it shows the maximum crest of curvature in the cervical third, I mean to say that maximum width is seen at the cervical third, and from there it drops down like a straight line to the tip of the uh, incisal tip. And on the lingual aspect, you have a maximum crest of curvature till the middle of the middle third. That is not only the cervical third, but also middle of the middle third. That's because you have the cingulum over here. Cingulum is a prominence. So you see that crest of curvature because of the cingulum till the middle of the middle third. And after the crest of curvature, we can see a concavity. That concavity is due to the lingual fossa. Lingual fossa is a depression, so we can see that as a concavity, and then which is followed by a convexity due to the incisal tip. So that's about the um, lingual aspect, sorry, mesial aspect. So also, if you draw a straight line which bisects the root, it will correctly go to bisecting through the crown. That means the long axis of the tooth on the mesial aspect will actually bisect the crown and the root similarly. So that's a picture of the mesial aspect. It is just that the diagram is shown the other way around. One is of the right central incisor and the other one is of the left central incisor. But then you can appreciate the dip of the cervical line here. You can appreciate the labial outline. You can appreciate the lingual outline, which is showing the prominence of the cingulum and the concavity of the lingual fossa, and you can see the root. So the distal third is also very similar to the mesial out. The distal aspect is also very similar to the mesial aspect. It is the only difference is that the cervical line does not dip as much as the mesial outline did. So in the mesial surface, the cervical line dipped more towards the incisal tip, but in the distal aspect, this dip is much lesser when compared to that of the mesial aspect. So that's the distal aspect where you can very clearly see that the dip is very less when compared to that of the mesial aspect. Now coming to the incisal incisal aspect is when you remove a tooth and you look at it from the incisal third. Like if the patient's tooth is inside the oral cavity, you look up onto the tooth from the incisal portion. That is called as the incisal aspect. So when you see the incisal aspect, I can explain from this picture. This is the incisal ridge. So if you can imagine that this is the incisal ridge. When you look up into the onto the incisal aspect of a tooth inside the oral cavity, you can actually see that this is the incisal ridge. So whatever is above the incisal ridge is basically the labial aspect, and whatever is below the incisal ridge is basically your lingual aspect. So you can actually see that the convexity is very high, and suppose this is the labial aspect and this is the lingual aspect and this is the incisal ridge. So we know that labiolingually it is wider, and in that labiolingual width, the distance between the labial maximum curvature till the incisal tip is more than from the lingual outline to the incisal edge. And you can also see the inverted W-shaped groove and the cingulum from the incisal aspect. Of course, the fossa as well. So you can see the lingual fossa here, you can see the grooves there, and you can see the cingulum out there. So that is the incisal aspect. So to summarize, you can see that this is the labial aspect where we have a rounded disto-incisal angle and a very sharp mesio-incisal angle. And in between, you can see this in a newly erupted tooth, you can see the mamelons. These are the rounded protuberances on the incisal aspect is called as the incisal third is called as the mamelons. So these mamelons basically represents the lobes from which this central incisor has developed. So which I mean to say that the labial aspect is derived from three lobes, and the fourth lobe gives rise to the lingual aspect. So in the lingual aspect, you can actually see the prominent lingual fossa, and the lingual fossa is surrounded by the cingulum cervicalis, the rounded distal marginal ridge on the distal side and distal outline, and the sharp mesial marginal ridge on the mesial outline, and the incisal ridge incisally. So on the mesial aspect and the distal aspect, you can see that the mesial aspect has got a labial outline and a lingual outline. So on the labial outline, the crest of curvature or the height of contour is at the cervical third, and on the lingual outline, the crest of curvature is at the junction of the middle and the middle third and the middle of the middle third. And after that, we have a concavity due to the lingual fossa and then the incisal ridge. So it is similar on the distal aspect. The only difference is the cervical line dips much lesser when compared to that of the mesial aspect. And then you have the incisal outline where you can actually see the sharp incisal ridge. So whatever is above the incisal ridge is your labial outline, and whatever labial surface, and whatever is lingual is your lingual surface. So you can see a more rounded disto-incisal angle and a more sharper mesio-incisal angle. So that's about today's class for maxillary central incisor. I hope you all have understood. I'll come up with more lectures in dental anatomy. Thank you so much for the patient listening.